The history element of the heart score is the most subjective one and requires a careful assessment before deciding whether to score it 0, 1 or 2. This is our approach. When the history of the patient contains mainly specific elements such as left-sided, crushing, squeezing or heavy chest pain that radiates to the left or right arm, to the shoulders or to the jaw, or if the chest pain is associated with vomiting or sweating, then this history is more suggestive of cardiac ischemia and should score 2 points. If the patient reports pain on exertion, such as walking upstairs or strong emotion, then this is also more suggestive of cardiac ischemia. Alternatively, if the history of the patient contains mainly non-specific elements, such as right-sided pain that is stabbing or reproducible with direct pressure or movement, and worse on deep inspiration, then this history should be scored 0. The duration of symptoms is important. Pain that lasts seconds or less than a couple of minutes is unlikely to be ischemic chest pain. Other less specific components include nausea, shortness of breath, and pain that does not radiate. When the history contains both specific and non-specific elements, then this should score 1 point. For the scoring of the ECG, 2 points are given in case of ST deviation, which is elevation or depression greater than 2 mm in at least 2 contiguous leads, or new T-wave inversion. 1 point is given when the ECG shows non-specific or old repolarization disturbance, such as non-contiguous T-wave inversion, left bundle branch block, or a paced rhythm. And 0 points are given if the ECG is normal. The scoring of age is based on cutoff values of 45 and 65 years. The scoring of risk factors is based on the established risk factors for atherosclerosis, namely hypertension, hypercholesterolemia, positive family history, diabetes, smoking, or obesity. When the patient has 3 or more risk factors, or if they have an established history of coronary artery, peripheral vascular disease, or stroke, then 2 points are given. 1 point is given when the patient has 1 or 2 risk factors, and 0 points if there are no risk factors known. The scoring of troponin is based on the first troponin measurement at the ED. In the original heart studies, which were conducted prior to the widespread use of high-sensitivity troponins, 2 points are given when the troponin level is more than 3 times the reference value. 1 point is given for a troponin between 1 and 3 times the reference value, and 0 points are given when the troponin is below the reference value. Whilst this has been shown to be a safe and effective strategy, the heart pathway with 2 sequential troponins and the arrival of newer high-sensitivity troponin assays are changing the way we use and apply the heart score, and this will be discussed later on in the video. So now you know how to calculate a heart score, why don't we show you how this might work in practice?
Hello.
Hello.
Hi, my name's Caroline Fitton. I'm one of the accident and emergency registrars. Oh, thank you. I understand you've been having some chest pain.
Yeah, when I was at work this morning. That was about 4 hours ago.
Are you still in pain now?
No, it's not too bad now.
Okay, good. I'm glad to hear you're feeling a bit better. Would you be able to tell me what the pain felt like?
It was like a pressure pain, but it felt worse when I was breathing in.
Okay. Did it spread anywhere? Into your neck or down your arm?
My upper back and my shoulder.
Okay. How long did it last for?
About 2 minutes.
Have you had a pain like this before?
Yeah, recently when I was running for a bus, but didn't think much of it.
Okay. Do you find if you're exerting yourself, such as going upstairs or if you're feeling stressed, that it brings the pain on?
No, not really. It's only when my boy asked me for money.
Okay. And have you ever been to see your doctor about a pain like this before? Or are you on any medications?
Yeah, I'm on medication. I'm on high blood pressure tablets. I think they're called Randy-Pill.
Ah, Ramipril.
Oh, Ramipril. All right, okay.
And do you have any other medical conditions, such as diabetes or high cholesterol?
Last time I went to the doctors now.
All right. Do you smoke?
I used to, but I packed up about 3 years ago.
Okay, that's good. And do you mind if I ask you how old you are?
I'm 62.
And did your mother or father or any of your siblings have any heart disease or any of them have a stroke?
My father had a heart attack when he was about mid-50s.
Okay.
And that's about all I know. Yeah.
All right, well, thank you very much for that.
Okay.
I'm going to have a look at your ECG. Your blood results will be back shortly, and then I'll come back and have a chat.
Right, thank you.
Thank you. Bye.
See ya.
Well, that was interesting, because the history did not sound like classic angina, but there were certainly elements suggestive of cardiac ischemia. So I think this history would score a 1. Now for the ECG, I see that there is some non-specific T-wave inversion in V3 to V6. So this would also score a 1. If, however, we had an old ECG that showed that this was new, we might consider scoring this a 2 as it could represent new ischemia. Mr. Giddings is 62, so he would score 1 for age. And in terms of risk factors, he has a father who had an MI in his 50s, and he has hypertension. He did smoke, but because he has quit more than 90 days ago, we would not score this as a risk factor. So that makes 2 risk factors and would score a 1. So all we have to do at this stage is add the high sensitivity troponin, which in this hospital has a sex-specific cutoff of 34 nanograms per litre in men and 15 nanograms per litre in women. In this case, Mr. Giddings has a troponin of 27, which is below the cutoff, and in the traditional interpretation of heart score, would score a 0. This gives a total heart score of 4 and would put the patient into an intermediate risk category. So the question you might have is, what are the next steps for managing a patient such as this?
Thanks for waiting.
That's okay.
So we've got your blood results back and they're negative, so that's good news for the moment. What we will need to do though is to do another repeat test just to make sure and be extra cautious. If that test comes back positive, what we would need to do is to admit you to hospital. If it doesn't, we'll be able to send you home and we'll bring you back to the Rapid Access Chest Clinic.
Do I need to be worried?
I don't think you do need to be too worried at the moment. We're just being extra cautious that nothing's happening and you're in the right place for treatment if anything is.
Thank you.
We would like to thank the Homerton University Hospital Emergency and Education and Learning Departments for their support during this project, and in particular to our main sponsors Abbott, Crievo, Rebel EM, Hippo Education and MD Calc, without whose generous assistance these videos just would not have been possible. Thank you, you totally rock.